Okay, well, I'm Dr. Martin Ray, and I am the medical director and owner here at View Laser Skin Rejuvenation. We're located in Delta, and then actually want to dial it down a little closer. We're in Tsawwassen, right off the main street. But I'm going to introduce Natalie here. And Natalie, I've known you since you were 5 years old.
So 40 years.
Yeah. And so, Natalie, tell me a little bit about your headaches. And these are migraine type headaches that you've been suffering from.
Yeah, I started suffering probably around when I was 13, 14, and they got worse and worse. I think as my hormones started to imbalance more as I've gotten closer to probably menopause now, because I'm 45, turning 46 this year. And I've really noticed the change, severity, frequency, everything. So I've known you since I was 5. You've been my GP. And I felt that, you know, when you first talked to me about the Botox treatment, the therapeutic Botox for migraine treatment, and I think it was 15 years ago, I was interested and we did it. And I felt comfortable you treating me with it because I've had a long-standing relationship with you as a doctor, and I feel such comfort and ease knowing you were injecting me and trusted the whole process. And right away, within, I think it was like a week and a half, it changed my life. Like going from 5 days a week of having such severe, horrible migraines, where I'm in bed in the dark, having my job, my kids, everything. It's just horrible. And I'm sure as many people who have migraines understand how traumatic it is and how you can't just take an Advil and go on with life. It doesn't work like that. Coming here to View Medical, like it's my family. I feel like it's a family.
View Medical's our family doc.
View Medical's here since I was 5, so 40 years.
View Lasers, our laser component.
So now coming upstairs to View Laser, like I feel like it, and the staff I've known forever, longtime staff, and they're so lovely that whatever you'd recommend to me, I'd take with a lot of weight, because I truly believe you just want to better people.
Well, that's true. That's what makes me do this over and over again for people. And treating migraines with therapeutic Botox is one of my favorite things to do in this practice. So how do you look cosmetically after your therapeutic
I think
Botox?
I lost more awake than...
Awake, rested.
Well, I think, right? Because I feel like it almost pulls it up a little bit. I've never felt it made me look... I feel like it makes me less tired looking.
Less tired.
And I've never had any bad effect from any of it. And, and I've had a lot of needles put in me in these years, decades.
My secret is that I actually modify the prevent protocol. So I still go differently in the forehead, and I go differently in the neck. And if you have some TMJ problems or masseters where you're clenching and grinding, I'll include that in our protocol. That's the secret. And I'm happy to share with anybody that's interested, whether it be physicians or patients and things. But I think that takes the effectiveness of therapeutic migraine treatments from about 60%, where most people are going to need extra medicine, up to well into the 90s. 95, 99% of my patients will have a significant benefit, if not being able to get off all their drugs.
Wow.
As you have.
Yeah.
Thank you for sharing. And let's get going and give you your treatment.
Okay. Sounds good.